Dr. Vikki Petersen. Today's question is one I'm very excited to answer. It's about someone who was recently diagnosed with depression. She's taking antidepressants, but through some research of her own, she's learned about a bit of a connection between her celiac disease and depression, and she wants to know if those two are indeed related, and they most certainly are. It's interesting because when you think of celiac disease, you immediately think of digestive complaints. However, celiac disease, as we know, is just a very small component of the bigger picture called gluten sensitivity. And with gluten-sensitive patients, only 1/3 of the time do they have digestive complaints. A full 2/3 of the time, their complaints have nothing to do with digestion, but are related to other systems of the body. The most common system affected after the digestive tract is the nervous system. So the research that I quote in my book is that 20 to 30% of the population who is gluten sensitive suffers from depression. This is far and above the 5% suffering from depression of the non-gluten sensitive population. So we see a huge increase, a 4 to 6-fold increase of patients suffering from depression who are gluten sensitive. So why is this? There's a couple of areas that can be coming together to cause this. One, of course, with gluten sensitivity, we're having malabsorption. Whether you're having digestive symptoms or not, malabsorption is occurring due to the damage created in the small intestine by the gluten. With that malabsorption, certain amino acids cannot be absorbed as they should, one of which is tryptophan. Tryptophan is the amino acid that helps to make serotonin, the neurotransmitter that actually antidepressants are working to keep around longer in your system to help with depression. So instead of taking antidepressant drugs, which have very dangerous side effects, much better to heal the intestine, allow absorption to thereby increase, absorb your tryptophan naturally, make adequate serotonin, and see what we see in the clinic very frequently, which is the ability to get people off of their antidepressants because we've actually gotten to the root cause of where the depression is actually coming from. So that's one area, the malabsorption area. The other area looks at the effect created upon the nervous system. So what happens is gluten is coming into the small intestine, it's escaping the small intestine, very often only partially digested, and that protein goes into various parts of the body and can create problems, and the nervous system and brain is one of those areas, and it actually can create inflammation, and that inflammation sets off a cascade of events affecting the balance in the brain and nervous system, and depression is one of those results. So I'm definitely trying to summarize this for the sake of a video, but in our book, The Gluten Effect, we go into this in great detail, and I hope this helps. Truly, this is an area that's very exciting because depression, unfortunately, is treated, as I mentioned earlier, with dangerous drugs, and the side effects of those are something that we wouldn't want anybody to suffer from. So much better to get to the root cause, and we're certainly finding out that gluten sensitivity is a very real root cause for depression, and when treated properly, the depression can be corrected. So I hope this helps, and until next time, to your very good health.